It's another day with the physicians where your health is our business.
Growth spurt will end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the Training Author of your regular program. In Africa, chronic viral hepatitis affects over 70 million Africans. Hepatitis refers to an inflammatory condition of the liver. It's commonly caused by a viral infection, but there are other possible causes of hepatitis. If you have infectious form of hepatitis that are chronic, like hepatitis B and C, you may not have symptoms in the beginning. Symptoms may not occur until the damage affects the liver function. On today's program with the physicians, we will learn more about hepatitis, its risk factors, causes, symptoms, diagnosis, and management from the expert. Just ensure you stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, and we're going to be talking about hepatitis, its causes, risk factors, diagnosis, complication, and a whole lot on your regular program, The Physicians. As usual, I'm not alone on this program. I have with me a very lovely, elegant celebrity shrink. No other person than
remain Dr. Imuna Yusuf Kadri. You're welcome on board.
You're laughing. You know, I'm actually very happy with you. You're looking really good.
Thank you.
Anyway, we're talking about hepatitis today.
Yeah.
Have you ever encountered one, or you've had it before?
There have definitely been a medical doctor. There's no way you wouldn't, but I remember a very specific one with a house help. And so when I get my house help, I usually do the screening before they come on board. And then I did the screening and she was positive. And she just told me where she is coming from. The couple had two babies, a baby 6 months and the older one 2 years. I had to call that family to alert them that the lady that you could just let go has hepatitis. So you have to do something about it, because I just felt I owe them a duty to let them know why I referred her to the hospital to go take care of herself. Yeah. So
okay, what is actually very frightening is people don't know much about hepatitis, and to even think that is even worse than HIV/AIDS. People did not realize that. But there was
a silent killer actually.
Yeah, there was so much noise when HIV first started. And not much was talked about hepatitis.
Yeah.
And people do not know the reason. Some just feel, I think it's because of the stigma that is associated with HIV/AIDS at that time.
More of the
stigma.
Yeah. So I guess with the experts coming on board today, she is going to help, demystify those myths and enlighten our viewers out there. The importance of this hepatitis screening, especially among our domestic staff, chef, nannies, housekeepers, people within our inner circle. Now everybody is running around for COVID-19 tests, but hepatitis is very key. Yeah.
Well, we'll be back after this time. I'll just stay tuned. Don't go away. If you are just joining us, you're on your regular program, The Physicians, where your health is our business. Like I said earlier, we'll be discussing hepatitis, causes, risk factors, diagnosis, treatments, complications. And with me in the studio is a guest that we've been looking for. She is a consultant, public health physician, an associate prof with the College of Medicine, University of Lagos, Dr. OLUKEMI Odukoya.
Thank you very much.
Welcome to our program.
Thank you.
Welcome, Prof. You look glamorous. I love seeing lovely, young-looking profs.
You guys are my inspiration.
Welcome to The Physicians.
Thank you. Thank
So
you.
now we're talking about hepatitis. You just want to give us an overview. What is hepatitis? Overview.
Okay, thank you. So hepatitis literally means an inflammation of the liver. And for our guests, our viewers out there, we know there are many organs in the body, but right at the upper right portion, there's a large organ here. It does many things. It creates bile, which is important for digestion. It helps us with the digestion of carbohydrates, fats. It helps eliminate toxins, and it does a whole lot of other things. The liver is a very important organ of the body. And unlike many other organs in the body where we have two, with the liver we have just one. So we need to take care of our livers very well. Hepatitis is literally, like I said, when the liver gets inflamed. And there are many causes of this. But we could divide them broadly into two. So we could have the infectious causes. That's things that are of maybe like an infectious nature, viruses, parasites, and things like that. Then we could have the non-infectious causes, and that could be from maybe autoimmune conditions or maybe taking too much alcohol and things like that. The more common one, and the one that we're very concerned about from a public health standpoint, are hepatitis that are due to infections, because we're concerned about people passing infections, knowingly or unknowingly, from one person to the next and to the next and to the next. So if we want to talk about hepatitis due to infections, the ones that are caused by viruses are the ones that we're very concerned about. So, and that's called viral hepatitis. So we have 5 kinds of viral hepatitis. Hepatitis A, B, C, D, and E. Of these 5 types, we're very concerned about hepatitis B and hepatitis C, because these are very infectious forms of hepatitis. And we would say that hepatitis B and C are more infectious than HIV. So we have an estimated 20 million Nigerians who have hepatitis B.
20 million Nigerians?
Many of them do not know that they have hepatitis B. And you know the sad thing about hepatitis B? It's preventable. For everybody who has hepatitis B, the person is not supposed to have it, because we have ways of preventing hepatitis B, the primary one being vaccination. If we're all vaccinated as at the right time, we shouldn't be having hepatitis B.
What's the mode of transmission? How do you get it?
Thank you for asking that question. So with hepatitis B, it's mostly transmitted when an infected pregnant woman gives the virus to her child, either during pregnancy or during the process of birth. And that's the reason why hepatitis B vaccinations are they're baby vaccinations given as soon as possible after a child is born, and then at the 6th week, the 14th, the 6th, 10, and 14th. The 6th week, the 10th week, and the 14th week. Now, if a child, whether or not the mother has hepatitis B, receives those 4 vaccines, that child isn't going to get hepatitis B. So the most common way of getting hepatitis B is through that route. You can also get hepatitis B, or other people can get, because hepatitis B is a blood-borne infection, from sharing sharps. Healthcare workers are also at risk of getting hepatitis B for obvious reasons. People who share anything that can cause a bruise in the skin, so that could be sharing needles. For those who use drugs, they're also at risk of hepatitis B and C. And they're sharing razors or clippers or things like that. So good infection control practices, awareness, and then of course making sure that all those who need blood have blood that's duly screened, because people can also get hepatitis from infected blood unknowingly.
So what are the presenting symptoms?
Symptoms, thank you. So how do we know if somebody has hepatitis? For the viral hepatitis, we have the acute forms and then we have the chronic form. So with the acute form, that usually takes place about in the first 2 weeks after the person has been infected, and it has some non-specific signs, a bit of tiredness, fatigue. The person just says, I'm not feeling very well. Sometimes it could go unnoticed. However, there are some telltale signs. The person's eyes may be yellow, or the person's urine may be dark. But we also need to know that acute hepatitis may go unnoticed and usually takes place in the first 2 weeks of infection. Now, for some people, they would have acute hepatitis, and the body's immunity would kick into play and get rid of the virus, and then they're fine. But then for some people, that acute hepatitis would move on to what we call chronic hepatitis. Now, people that have chronic hepatitis are able to transmit hepatitis from one person to another. And then I didn't mention, yes, just like HIV, because it's bloodborne, people can also get hepatitis from unsafe sex. So someone who has chronic hepatitis may have no symptoms at all for a very long period of time, until the person has the complications of hepatitis. Now, the unfortunate thing about the complication of hepatitis is that we do not have effective forms of treatment for the complication. There are two very bad complications. One of them is liver cirrhosis. And at that point, the entire liver is totally inflamed, not functioning very well. More often than not, the person dies. Then there's primary liver cell carcinoma. That's the cancer of the liver. And for people who have this, it's one of the kinds of cancers that when the person gets to the doctor goes, go put your house in order. More often than not, the person would die within a year of diagnosis. So it's a really bad cancer. So that's the spectrum of the symptoms.
Okay. So you talked about 20 million Nigerians living with hepatitis without knowing.
Yes, but we don't know how many of them do know, but we do know that a majority of them are not aware that they have hepatitis. I think I remember Dr. Maimuna talking about screening her house help. There are many people who are just like that, who have the virus, who are able to transmit the virus, but have no idea.
How is the diagnosis made then?
Oh, great question. So how do we know, or how can we find out if people have hepatitis? There are tests. The good thing is we have a way of diagnosing it. And there are rapid tests. The good thing about the rapid tests is that they get the results immediately. And what the rapid tests do is that they check for the surface antigen. And then we also have tests for antibodies. So if somebody has the antigen of the hepatitis B in the person's blood, then that does give an inkling that this person is infected with hepatitis B. There are other tests. There's the ELISA test. Then, of course, for people who are really ill, we have imaging tests like tests that check the liver, CTs, and then we also have blood tests, the blood liver tests, the liver function test, and things like that. Yes.
Okay. So knowing that people actually, there are some people that will have hepatitis without knowing, without manifestation, which is actually very deadly. I want you to expatiate more on that when we come back.
Okay.
I have a lot of questions to ask regarding that aspect.
Okay.
Just hold on.
All right then.
Don't go away. We'll be back after this short break. Just stay tuned. We need to keep up with the physicians outside.
Yeah?
Yes, yes, of course, I've heard about it. About 2 or 3 years ago, they came to office to test us for hepatitis.
It affects the liver.
The hepatitis B affects the liver of the human body by enlarging the liver.
The causes of many diseases, not only hepatitis, is uncleanliness.
The causes of hepatitis B is the transfusion of blood or semen from any affected person to unaffected person, either through sexual intercourse.
Yes, I agree. The hepatitis is worse, but much more curable than HIV and AIDS, but more deadlier.
Definitely, hepatitis B is worse than AIDS because it's a fast killer, unlike AIDS that is a slow killer.
It could be because HIV and AIDS could be detected easily. The person could be feeling funny and not long, but hepatitis as an ailment will not be discovered until it's almost too late.
Welcome back. If you're just joining us, you're on to your regular program, The Physicians, where your health is our business. With us in the studio, we have Dr. Kemi Odukoya. Actually, she's been doing justice to the topic, hepatitis, the risk factors, the causes, and she makes mention of something, that at least we have over 20 million Nigerians that have hepatitis, not even knowing. Dr. Kemi, let me ask you something. Are you not saying that it is going with the factors, the complications, the risk that is involved? Are you of the opinion that everyone should go screen for hepatitis? Because some are just without symptoms. So is it advisable for us to say everybody should go and screen for hepatitis?
Yeah, thank you. That's a good question. So what do we need to do? We've had all this talk about hepatitis. It will be helpful if people can get screened. For those who don't have hepatitis, they should get vaccinated, particularly for people that are high risk, people whose jobs involve contact with blood and blood fluids and things like that. But we're very concerned about babies. We're very concerned about infants because we believe that if you can vaccinate children, babies, even if they do come in contact with the virus as they grow older, they're already protected. And if we can vaccinate all the babies that are born over a period of time, there's going to be nobody available to give anybody hepatitis B. Okay. And that's the reason why the WHO has actually targeted hepatitis for elimination. It's possible, to eliminate hepatitis.
So aside from the viruses, causing of the hepatitis, are there like other medical conditions that could lead to hepatitis?
Yeah, thank you. Now, we have put a lot of emphasis on the viruses because the viruses are the communicable forms of hepatitis. Yeah. But there are many other causes of hepatitis. And like we said earlier, people who take a lot of alcohol, too much alcohol, are likely to get inflammations of the liver, and then they could also have some of the problems that we've talked about. There are also some autoimmune diseases. And what do we mean by autoimmune diseases? When, for some reason or the other, the body begins to develop antibodies against itself, such that it destroys itself, that could happen, and that could cause a form of inflammation of the liver, and that's also a very severe disease. There are also some more rare causes, but the ones that we try to, in medicine and in public health, try to focus on the things that we can change. We can reduce the amount of alcohol that we take. If we know that alcohol can cause inflammation of the liver, then we can say, do not take more than a recommended amount of alcohol, maybe per week or something like that. That would help. For the autoimmune disease, there's a lot of research going on into that area. Some people have it, some people don't. We don't yet know why. Some people have autoimmune diseases, but we do know that there is treatment for that.
I know some people used to talk about fruits. Is there a room for fruits? People, if you don't wash your fruit properly, can you get it from there?
Well, for hepatitis A, yes. I said there were 5 types, and they are transmitted in different ways, ironically, not all the same way. Hepatitis A can be, people can get hepatitis A if they do not just fruits, food, any form of eating anything that's infected. So poor hygiene, poor sanitation, and things like that, that can cause hepatitis A. But the good thing about hepatitis A is that it doesn't usually cause some of the really bad complications. Sometimes it's self-limiting. In very rare instances, we have very bad cases of hepatitis A, but more often than not, if we want to look at the magnitude of the severity of the illnesses, hepatitis A is relatively milder than B and C.
Okay. For individuals that you've diagnosed that have hepatitis, is there still a room for vaccination?
Yeah, great question. So the question would be, if somebody already has the disease, would that person benefit from vaccination? No. No.
Wow.
No. If somebody already has the disease, the person would have to get treated. And that's the reason why it's helpful to get tested. Because if you do get tested and you realize you're negative, great, go get vaccinated and then you'll be fine. But if the disease is already in place, then vaccination will be of no effect.
Is the vaccine for life?
That's a good question. We expect that the vaccine should confer a considerable amount of lasting immunity. Whether that's lifelong, I'm not quite sure. But it does confer strong lasting immunity.
So aside from vaccination, which we now know is the one that is highly preventive, what are the basic modalities of treatment that we should expect in managing?
For prevention would depend on the cause. For hepatitis B and C, because they are blood-borne, the same way we would want to prevent HIV, and all the things that we do that prevent HIV would also work for hepatitis B. So we want people to have safe blood. If they need blood, they would have safe blood. We would advise people to avoid unsafe sexual practices, because if people are infected with hepatitis B and they have sex with somebody who doesn't, then they could also get it. Then we also want to advise people against sharp cultural practices, harmful cultural practices that promote the use of shared sharp instruments, because those can also serve as forms of transmission of hepatitis B, particularly the infectious forms. And then, of course, like we said earlier, injecting drug users are clearly at risk. In fact, in some parts of the world, they even give them needles because they don't want them to get infected. So that's another group that's high risk, and the kind of interventions we have in that regard can help prevent hepatitis.
Okay, so for those on medication, they use it to treat the symptoms?
No.
For how long? Is it for life, the treatment for life?
Yeah, that's the thing. For hepatitis B, the treatment doesn't confer a cure. What the treatment does is that it's similar to HIV. It reduces the likelihood of somebody coming down with the terrible forms of the disease. For hepatitis C, there is treatment, and that's given for a specified period of time, and you expect that person to be hepatitis C free after treatment. So it depends on the kind of hepatitis we're dealing with. For inflammation of the liver that's due to alcohol, that's it. If somebody has that, that's it. Except you want to have a liver transplant, of course. That will always work, but then we know that that's not always as straightforward as it sounds.
Oh.
Yeah.
Interesting.
You've done a real justice to this topic.
Thank you.
We really appreciate your coming on this program.
Thank you.
very
It'll be my
much.
pleasure.
Yeah,
Thank you.
Thank you so much.
Thank you very much.
I'm sure you guys out there, you actually heard it from the expert herself. We have over 20 million Nigerians at least who don't even know that they have hepatitis. Are you one of them? It is good to check. If you have any challenge, anything, do not hesitate to go to the physician, to the nearest health center. The yellowness, I understand the yellowness of the eyes as if one has jaundice. It has to do with the liver. Try as much as possible to give your health priority. Well, Memuna?
Of course, you've all heard it from the expert, the 5 different types of hepatitis, but B and C, they are the ones that truly we should all look out for. And she has broken it down to how you can easily get infected. And if you're already positive, vaccine wouldn't work for you, but there are other treatment modalities. So please, stay safe. This is the most important thing. And with this global pandemic, every other thing that will boost your immunity and keep you safe is what we advocate for each and every one of you. I remain Dr. Memuna Yusuf Kadri. Till next time, stay blessed.
Don't forget to follow us on our social media handle, Facebook, YouTube, and of course, Instagram. Till next time, stay blessed.
I am Dr. Olufunke, consultant physician from LUTH. I've been talking about asthma, and please don't stigmatize patients with asthma. Give them all the support they need, and kindly keep washing this program, The Physicians.